We had an Ebola scare in northern Colorado this morning, and now that patient is being treated at the University of Colorado Hospital in Aurora. This even after her blood test in Loveland this morning came back negative for the virus. 7 News reporter Lance Hernandez tracking these new developments. Lance, health officials are alarmed that this woman wasn't on the radar despite her extensive travels in Africa.
And health officials tell me that there are obviously some gaps in the system. They call this a broken itinerary. The patient, a European woman who works for an international humanitarian aid organization, was working in Ivory Coast, Africa. She traveled from one Ebola-affected country to a non-Ebola-affected country, stayed there for a few days, then came to the U.S. to visit some friends in northern Colorado, and that's when she came down with a fever. Now, during a news conference earlier this afternoon here at University of Colorado Hospital, I asked health officials if they're concerned about that gap that allowed the woman to travel to this country without anyone knowing she had been in an Ebola-affected region.
We certainly have had conversations with CDC about the system, and CDC is certainly looking into how these types of gaps may occur. But unfortunately, they do occur. It's really difficult to track people who travel to multiple countries.
Now, again, that patient tested negative for Ebola. Doctors aren't sure what's causing her fever. They are assessing her here at this hospital as we speak. They say they're not sure how long she'll be here at this hospital. Reporting live in Aurora, Lance Hernandez, 7 News.
Thanks, Lance. And earlier this week, 5 Americans being monitored for Ebola in Nebraska were released from being held in quarantine. The healthcare workers were exposed to the virus in Sierra Leone. They were kept in quarantine at the Nebraska Medical Center for 21 days after they returned to the U.S. The hospital has a specialized biocontainment unit and treated 3 patients with Ebola last fall.